Well, many times people will take for granted their hearing until maybe they don't hear as well as they should or hear as well as they would like to. We're at Coastal Hearing Center today talking to Karen Slater. How are you?
Great, thank you.
So we've talked to you, we've shot one segment before, we covered a whole bunch of things. Today, we're going to focus on hearing aids first. So tell us a little bit about the new hearing aid. It's not the same hearing aid as it was like 20 years ago, maybe even 10 years ago.
Even last year. Every year the technology gets better and better, and it's all about filters and cutting out background noise so that you can hear speech better, because that's everybody's problem, is hearing speech when there's noise present.
So now if individuals were beginning to think that they're having a hard time, what are some of the first signs that they might need to come chat with somebody here in your office?
So usually a loved one first notices that their person is not hearing well or not answering the questions correctly, and they'll start talking about needing a hearing test. They'll come in, we'll do that comprehensive test that we talked about last time. Then we'll come into this room and we'll discuss all the options that are available, whether it be if there's medicine or surgery, we'll refer you on to an ENT doctor. But if it's a nerve hearing loss and hearing aids are your best option, we have several different types of hearing aids and different levels of technology. So we sell hearing aids. We can give away a donated hearing aid, and you just pay us for the service of reprogramming it. So if a person's on a budget from $500 all the way up to $5,800, I have every budget that we can address.
And so we were talking earlier, there's this awesome technology that is behind you. Everybody's different, right? We're all made differently. And so the ear canal that the sound goes through to get to the eardrum, they're all shaped a little differently. So one person hears so much differently than the other, and you have a way to help that.
Right. So I have a Real Ear, which is a machine that helps us program the hearing aids, because in general, everybody's ear canal resonance is the same. But what happens is when speech goes through a tunnel, it changes. So when I talk like this and I talk like this, my voice changes a little bit. Well, everybody's ear canal has its own resonance. Hearing aids are designed with the average ear canal in mind, and that's addressed initially when we first get started. But every now and then there's somebody that just is not happy with their hearing aids. I can't program it. No matter what they say, I can't figure it out. That machine, I put a microphone way down in the ear canal, right next to the eardrum. I put the hearing aid on top, and then it does this testing so that the amplified sound going through that tunnel, that resonance, is picked up, and then that machine tells my computer what we need to do to make it better or worse to give him the best sound quality possible.
Listen, technology never ceases to amaze me. This is also one of those things. I've noticed over there you have some devices that you can hook straight to streaming.
Yes.
You have even some devices that you can use a phone, your cell phone, to change the.
So most hearing aids now are Bluetooth compatible with Android and with iPhone. This is just a normal pair of hearing aids. This is what they look like. This goes down in the ear and this goes behind the ear. We also sell the custom hearing aids that fit all the way in the ear. This is the one that is most popular with everyone. It is less visible because it's just the string that people are seeing. The hearing aids can hook up to your phones, and that can be your remote control. And then you can change, like if there's extra background noise, the hearing aid's already going to address it, but you can do more by a hit of a button and cut down background noise. Wow. You can turn the volume up or down. You can beam the hearing aid where you want to hear. Let's say you're driving the car and the kids in the back, you want to hear them, you don't want to hear the windshield, so there's a button and it makes the hearing aids point to the back.
That's crazy. And then, of course, we mentioned the streamers. You can just plug this device right into your TV.
So this is a TV streamer. Yep, we pair the hearing aids to this, and then that is with your TV, and with your remote control or a button on the hearing aid. When you're watching the TV, you can stream it. So instead of wearing headphones, your hearing aids are the headphones. And so let's say the wife wants to read a book. The husband wants to watch TV, and so he can hear it straight through his hearing aids. Or the wife likes the TV at one level and you like it at a different level. Because of the streaming, it's able to do that.
And then to take things a step further, you have the cochlear implants, and we're going to bring someone else in, a subject matter expert, maybe to talk about that. Right.
So one other type of hearing aid that we also sell is called a bone-anchored hearing aid. That is, a surgeon, an ENT surgeon, would have to put a titanium screw into a person's skull, and we pop the hearing aid onto that. So that would be for somebody who's single-sided deafness or a conductive hearing loss where there's nowhere to put the hearing aid if you have that, if you don't have an ear, or if it's very drainy and it would stop up the hearing aid all the time, we would have to get the hearing aid through bone conduction. And so this is called a Baja, and it just pops on. And the ones that we do here are from Cochlear Corporation, and they also do the cochlear implants.
Perfect. So what if hearing aids are not an option and that doesn't help at all? What are you going to do? Well, that's a great question, Chet. That's why I've got Dr. Mindy Taylor here to tell us about cochlear implants. So tell us about this.
Yes, so cochlear implants are an option for people who are having difficulties with their word understanding. They can range from babies starting at 9 months up to as old as you could be, as long as you're fit for surgery. That would be determined by the surgeon. A cochlear implant is a device, is a medical device, FDA approved. This is the implant itself.
That's what goes in your head.
Yes,
Gotcha.
so the surgeon would put this part underneath the skull and then stick the electrode.
Piece is right here.
Yep, right there. And stick the electrode itself down into the cochlea. So we're replacing basically the whole organ with this little device here. About a month after the surgery, the patient comes back to the office to see me or one of the other audiologists that works with cochlear implants, and we do the initial activation. So that's the part where the patient starts to hear again for the first time with electrical stimulation.
And that goes on here.
Yep, so there's a magnet right here, and then a little device that goes on top of the ear. And then with this particular brand, there is another option that goes completely off of the ear.
Gotcha. So how frequently are you seeing these patients?
A lot more frequently now. So we started up our cochlear implant program last year officially, being partnered with Cochlear Americas as a provider for them.
Sure.
But over the last 5 years, we've had little patients here and there, but over the last year, yes, a big improvement and jump in those patients.
So we're going to talk with a patient now, not a cochlear implant patient, but a hearing aid patient who really has amazing things to say, loves everybody in this office. Well, we have Scott Hayner here, who is one of Dr. Taylor's patients here at Coastal Hearing. Tell us exactly what is the biggest benefit you've gotten out of this?
Being able to hear my grandchildren. I'd never been able to hear their voices, and 5 months ago was the first time I could actually hear their voices for the first time. My granddaughter used to come in the house, would never be able to hear them. My wife finally got on my case one day and said, "You need to go get your hearing checked." I came down here, been here ever since.
And you wouldn't give that away for nothing?
No way, not even slightly.
There you go. So listen, if you have questions, you got questions, calls, concerns, give them a call. The number's at the bottom of your screen.